Welcome to the Learning Studio. This is your home for simple, exciting, and meaningful journeys into the world of health sciences. In today's episode of our Health Sciences series, we're diving into something that affects every person on the planet, whether they realize it or not. Today, we're talking about public health and epidemiology, the powerful science behind preventing diseases, protecting communities, and keeping entire countries healthy. Let's begin. What is public health? Public health is like being the doctor of entire cities and nations, not just individual people. Instead of waiting for people to get sick, public health workers ask, how can we stop this illness from happening in the first place? They focus on clean water, healthy food, vaccines, safe neighborhoods, health education, and emergency planning. They save millions of lives, not with scalpels, but with smart planning and prevention. What is epidemiology? Now, let's meet epidemiology, the detective work of medicine. Epidemiologists are like health spies. They track who's getting sick, where, when, and why. They ask, why did this disease spread? How many people are affected? Is it an outbreak, an epidemic, a pandemic? How can we stop it before it spreads further? Epidemiology helps us discover what causes diseases and how to defeat them with science and strategy. What do students learn in public health and epidemiology? Students explore exciting and vital topics like disease prevention, how to stop illnesses before they begin, epidemiological studies, tracking patterns of who gets sick and why, vaccination programs, saving millions from deadly infections, health promotion, educating people about hygiene, exercise, diet, and safety, environmental health, studying pollution, clean water, sanitation, and housing, biostatistics, using numbers to understand health problems, pandemic response, learning from diseases like COVID-19 or Ebola policy, and planning, creating health systems that work for everyone. They also learn how one small decision, like washing hands or wearing masks, can save thousands of lives. Real-life example, how a town was saved. Let's go back in time to the 1850s in London. People were dying of a strange illness. No one knew why. A doctor named John Snow didn't guess. He investigated. He mapped the cases and noticed they were all around one water pump. He removed the pump's handle, and the disease stopped spreading. That's epidemiology. That's public health, and that's how one man saved a city. Even today, this kind of detective work helps us fight COVID-19, malaria, cholera, and more. How this field is used in hospitals and research. In hospitals, infection control teams track and reduce hospital outbreaks. Public health officers help prevent diseases from spreading. Doctors advise patients on vaccines, diet, hygiene, and habits. Community health workers monitor neighborhoods for health risks. In research, scientists study air, water, and disease patterns. Governments use data to create smarter policies. Global teams respond to outbreaks, like WHO and CDC. This knowledge helps countries protect their people before things go wrong. Why every medical worker must know this. Whether you're a doctor, nurse, pharmacist, or student, public health and epidemiology teach you the why behind the what. Why are some diseases common in one country but not another? Why do some people recover quickly while others get worse? Why does prevention matter more than cure? This knowledge is the foundation of smarter, safer, and more compassionate medicine. Public health professionals may never work in operating rooms, but they save lives before the patient even reaches the hospital. They are the ones who think bigger, who protect the unseen, who care for all. If you believe in prevention, care, and the power of community, this field is waiting for you. Thanks for watching. Don't forget to subscribe to the Learning Studio and join us in the next episode where we explore even more amazing medical topics, one heartbeat at a time.